Hi, thanks for joining us for today. Sorry if there was a little bit of delay. We had some technical difficulties we had to work through, but my name is Heather Florio. I'm the CEO of Desert Harvest. For those that don't know, Desert Harvest has been a leader in pelvic and sexual health products, especially in women's health, for over 30 years now. And today we are joined by Dr. Suzanne Steinbaum. She is the leader in preventative cardiology and is now in private practice in New York City. She is the CEO and founder of Adesso, a med tech innovation to identify and decrease the risk of women's cardiovascular disease and bringing prevention to every woman, regardless of the location or circumstances. Dr. Suzanne launched heart disease prevention programs at 3 leading academic hospitals in New York City, and she is the author of Dr. Steinbaum's Heart Book, Every Woman's Guide to Heart Healthy Life, and has been a national spokesperson for Go Red through the American Heart Association for almost 2 national National Medical Advisory Board of multiple companies, and is frequent guest on notable television shows such as The Today Show, Good Morning America, Oz, The Doctors, and more. She often lectures, participates in panels and podcasts, and is regularly interviewed, such as today. Thank you for joining us today, Dr. Seinbaum.
Thank you, Heather. Thanks so much for having me.
Yeah, so let's start with the basics. Let's really start. Why is cardiovascular disease the leading cause of death in women and kills more women than cancer?
It's really amazing to think about. This all started back in 1984 when more women started dying of heart disease than men. And when you look at the reason why, for the 20 years before that period of time, all the research was done on men's hearts. So now, 1984, women started dying of heart disease more than men. I keep joking around about it. We wanted to enter the workforce and we really wanted to do it. So we did it equally as much as men exactly at that time that we started dying of heart disease. We got what we asked for and we got their disease too. I don't know. But the truth is that not only was the research not done, but the education in schools was never focused on women's hearts. And in fact, even when I was in school, it was a man's disease, period. So now the research wasn't done, the doctors don't know. And when you talk to women, only 50% of women really understand that heart disease is her greatest risk. So when you put this all together, women are really dying of heart disease more than all cancers combined. And that is a true and sad reality.
It really is. It really is. And what's kind of the age profile that you typically see in regards to, assessing and determining cardiac health in women?
What's really interesting is that we used to think, and this is true, that it spikes about 10 years after menopause. So during that 10-year period while you're losing estrogen, you also have an increase in blood pressure and an increase in cholesterol and belly fat. And all of these things are risk factors for heart disease. And at 10 years later, so let's say the average age of menopause is about 52. By the early 60s, by
Mhm.
65, that's really when heart disease kicks in. But what's really scary is that there's an increased incidence in heart disease in women less than 55 years old. And so all of a sudden, this population that we really think of as being healthy and well and vital, there is now this increased risk of cardiovascular disease, heart attacks, strokes. And this is the age where should not be experiencing heart attacks. This is the age where we should be figuring out how to be healthy for the rest of our lives and really focusing on prevention.
Yes, definitely, definitely. This is the age where we normally just think about enjoying ourselves and actually don't think about the consequences a lot of the times of what we're doing to our bodies, especially in our 20s and 30s. Um, so what do you think is kind of, could we kind of review the symptoms that women should really be looking for to assess their own cardiac health?
The symptoms are such an interesting thing to think about. And so let me frame this in a maybe different way than we've all thought, okay? Because everyone's like, the symptoms of women are different when they're having a heart attack. Men, it's crushing chest pain and elephant sitting on the chest. Women, it's oftentimes more subtle, like shortness of breath, sometimes chest discomfort, but back pain, jaw pain, nausea, vomiting, flu like symptoms. But let me tell you this, I want to focus on not just what happens during a heart attack. Let's talk about the symptoms that are going on for years before, because it takes decades for heart disease to develop. One of the things that I think is so important about exercise is not just all the wonderful things that it does, like dilate arteries, decrease blood pressure, decrease sugars, keep your weight down, make you feel better, all of that, but it also becomes a way for you to test out how you're feeling. And if you're exercising or doing your stuff that you usually do every day, and all of a sudden you're getting shortness of breath, you're getting palpitations, you're getting some chest discomfort, you're feeling lightheaded or dizzy, think about your heart. Because that's the last thing that everyone thinks about. They think about everything else. But I want you to think about your heart when you're getting symptoms, when you're doing things that you're just used to doing.
Perfect. And so I think this is a really good lead in to really talking a little bit more about Adesso. Let's talk about how they might be able to utilize Adesso to assess their cardiac health for women.
The biggest issue is that if you don't think of a woman as possibly having heart disease, she's going to get misdiagnosed and ignored and sent home from the ER where she has a heart attack at home. And that's like the usual story. So Adesso really addresses those risk factors that matter to that woman. When you look at a standard risk analysis, it misses women about 50% of the time. It asks things like blood pressure and cholesterol, but it doesn't ask about the things that are specific to women and heart disease, like adverse outcomes of pregnancy. Did you have preeclampsia, gestational diabetes? When did you go into menopause? Are you in menopause? Was it early menopause? Let's go back to pregnancy. Did you have miscarriages or give birth early? All of these different risk factors, including hot flashes, how many and the intensity, those all matter when we think about heart disease, and certainly family history that isn't even asked on the standard risk analysis. So Adesso, My Adesso, it's in the App Store and Google Store, My Adesso, asks you the questions that matter most, like your family history, social determinants of health, stress, anxiety, depression, job satisfaction, and all about pregnancy and menopause. And when it asks you these questions, it gives you a more accurate assessment of whether or not you're at risk. And it also asks you how you're feeling.
Mm.
I have to say, one of the biggest issues that we as women have is really advocating for ourselves and getting the help
Yes.
we need. And Maya Desso, through education and learning more about your own heart and your own risks, can actually become a tool that you can take to your doctor to advocate for yourself, to learn how to communicate, to say, I'm not feeling well. My mother had heart disease. Do something for me, please. Because we do know that misdiagnosis and really not getting the diagnosis and treatment that we need as women, we could call it gaslighting, whatever you want, but we know that that happens and that it's a reality.
Yeah, I'll put it up here. Maybe we can see a little bit, but I'm downloading it myself right now, just so that we can, you know, I can do this for myself as well. I think every woman should utilize my Adesso because I think what you've created is brilliant in a way that you are right. We go out into the medical system. We are the ones that have been gaslighted, the ones that told that it's all in our head. So many times women, when they feel these symptoms, feel it's all in their head, that they're just making it up. They're being, hypochondriac or otherwise, because this is what we've been led to believe in the medical system. So I personally think my Adesso is amazing just in the fact that we can take our own cardiac health into our own hands and benefit from it. And if I remember correctly, you said, don't quote me, it's like $10.95 a month, right?
Yes. Yes, it
Yeah.
is.
Yeah. So very affordable platform. And I think you said like the first 3 months are free to test it out, correct?
We want everyone to test it out. And
Mm.
if you go to Focus 100, FOCUS, Focus 100, you will get it free and get to try it out. So, Myadesso, Myadesso, in the App Store, the Google Store. When you go to sign in with Focus 100, and it will take you into the Adesso journey of education and self empowerment, and see what you think.
Now, some of the most amazing things I think is in there is once you do kind of your cardiac profile, you get, you wear your Apple Watch and as well, and it pairs with your Apple Watch and really kind of monitors your heart health throughout the day. It also starts recommending tests, correct? That then you can then take to your doctor and advocate for yourself and say, I'm assessing my cardiac health myself, and I need this test, and this test based on my profile, correct?
What we really want women to do is learn about themselves and learn about their hearts. And it all starts with the heart score. But then, like you said, it links to your Apple Watch, Fitbit, anything. We're device agnostic, pair up, see what you're doing. But I have to warn you, the first 5 sessions is all about who you are in life and diet and exercise and stress. But then I really want you to do a deep dive on the last 5 sessions, which is really cardiology 101. It teaches you about your heart, it teaches you about your hormones, it teaches you about what happens when things go wrong, and it teaches you about those tests that Heather mentioned. What tests do I need? What blood tests matter? What we recommend are not tests that are considered maybe standard or that you're getting all the time. There are really unique tests that tell you about your genetic risk, that tell you about your metabolism, that really assess your risk accurately. So listen in, bear with it because it gets a little bit, like you're sitting in medical school, maybe a little bit, but it's just enough for you to understand. And they're short and they're easy and they're fun. And we actually turned my little dog into a cartoon that the heart dog takes you through the journey for you to understand really about how your heart works and what matters to you and how to talk to your doctor about getting what you need.
Perfect. And so it also lists like recommendations as well, lifestyle changes, other things like that. Can you highlight that a little bit?
Sure. Based on your blood testing and based on your metabolism and your risk, we actually do recommend a certain eating pattern, a diet for you. And we have links to wonderful diets, an Italian vegetarian diet, to a menopause diet, an African diet, a Latina diet. We have all different kinds of diets that are heart healthy. And so once you figure out what you need, and we'll explain it to you so you can, it will tell you what's the best for you and give you an outline, what foods to buy, some recipes. Not by me, by the way. I am no cook, no chef, but we did bring on board some amazing advisors and good friends of mine over the years who have really come on board to say you can eat heart healthy and have tasty food too. So really look into that. But it also tells you how to exercise. I always think about when I was younger, if you did not vomit after an exercise class, you did not do enough exercise. That was our mentality. And we know that's not true, that exercising in a moderate intensity zone, zone 2, is the best for you. We show you how to calculate that and figure it out. And then you could pair that to your Apple Watch. And so you know that 30 minutes, 5 days a week of a moderate intensity heart rate zone is amazing for your cardiovascular health, and 2 days a week of strength training with light weights, multiple repetitions. That's your sweet spot for heart health.
Perfect. Okay. And is there anything else that we should be looking out for as we do this app, like nuggets of information that that they should keep an eye out for as they go through this journey?
I think what one of my favorite things about it, because it's really fun to go through and really quick. You can do it as quickly as you want every day, checking in, journaling your life. One of the things that we know is the second you start paying attention, you start becoming accountable. It's like that diet concept. You don't sometimes need to go on a diet. You just have to pay attention to what you're doing. And I always think of this one patient who was so strict, but she would put her kids to bed and then start cleaning the house and eat about 1,200 calories after 11 p.m., doing the laundry and like whatever else she did. And I was like, just go to bed earlier and you'll be fine. And that was her diet. So it's this idea of becoming aware, becoming really mindful about what you do. And that's what we ask you to do on My Adesso. Journal every day. Check in with yourself. It asks you, how do you feel? What's We want you to connect to your heart, really. What's going on with you? Is this a good day? Is this a bad day? Did you eat well yesterday? Are you going to eat better today? What are you going to change? And so that idea of journaling and checking in, I think, is so important. But the piece that I love is that when you really want to understand something, we have what it's called the go deepers. And you just click on those go deepers and you can get tons of information and articles and research and really understand what's going on with you if that's what you want to do.
Okay. And does this also include like information, especially, I know you mentioned this briefly earlier, for our perimenopausal and menopausal women that are considering things like hormone replacement therapy, other things in the start of their menopause journey?
I think that we all got the message right now that menopause, perimenopause, it's a thing. It is a real thing when it comes to the heart. And talking to your doctor about using HRT hormones as a way to get through menopause with heart health is actually a real thing. And hormone replacement therapy, if it's taken the right way, in the safest way for you, can actually reduce the risk of cardiovascular disease and prevent dementia. And there has been so much misinformation out there that I think it's so important for us to really become self educated and be able to talk to our doctors about that as well. I want to recommend you also can go on adesso.health, which is our forward facing platform. It's for everyone, it's free, just to learn some things. Again, there are these amazing advisors that have come on board. And if you just want some general information about hormone replacement or diets or lifestyle issues, you can go on there and really check in with our advisors and learn a lot from them too.
And we do have that link in the chat to adesso.health. So definitely check that out, as well as that code for the App Store if you want to get started on there. So all of that is in the chat. Is there anything else that we can kind of add in for women in their heart journey beyond kind of what we covered, or should they just go jump in the app and get to it?
I think the one important, well, there are a couple of things, but one of the most important things to know, 80% of the time, heart disease is preventable. And I don't think we have a real understanding of what that means. It doesn't mean we wait until we're 65 and say, oh my gosh, we should do something. It means we begin right now because it takes decades and decades for heart disease to develop. We never ever think it's going to be our problem. We never connect to say, oh, yeah, one day I can have heart disease. It just feels like an old man's issue and not ours. And I totally get that. But I think the sooner that we realize that we have control over this by how we eat and how we exercise and manage our stress and how we really choose to live our days can absolutely impact how we live our lives. And I don't think up till now we've had enough information and enough understanding about how relevant this is for us, especially as we go through perimenopause or menopause. And especially for those women who've had any problems with pregnancy, just understand this is the time for you to really jump in and say, I'm going to take control of my heart. I'm going to take control of my health. There is something I can do about it. And yeah, start with my Adesso because it'll tell you everything. And it'll help you tell your doctor exactly what maybe the medical system has been missing, which is really diagnosing heart disease in women the way that it should be.
Thank you so much, Suzanne. I really appreciate all of this wonderful information for our viewers, and make it a priority, women. That's all I can say, and it wholeheartedly. It's important to me. It should be important to every woman out there, and the ability to be able to advocate for our health. Adesso, my Adesso, gives us that option, and we have to sincerely thank Dr. Suzanne Steinbaum for making this amazing app and for letting women take control of their health care. Check it out. And at the same time, if you do have any questions, you can definitely are welcome to put them up in the chat. And we'll make sure that maybe we can get some answers from Dr. Steinbaum. If you're having any issues checking out the app or need any information, please do check them out. Thank you so much.
Heather, thank you for being just out there speaking on behalf of women's health. All the work you've done is amazing. Thank you for being a pioneer in so many ways and an advocate for all women. And thank you for having me.